Hi dear friends, welcome to our video. So today I am going to discuss about a miracle drug for organophosphorus poisoning, that is atropine. Atropine, yes, atropine. Atropine basically belongs to a class of drug known as anticholinergic or antimuscarinic. Nergic or antimuscarinic. Now it is basically drug, or you can say prototype drug for antimuscarinic class. It is a prototype drug for antimuscarinic class and obtained from source, that is belladonna alkaloid. Belladonna alkaloid means belladonna is a plant from which alkaloids are extracted, and from those alkaloids the atropine is made. So this is about class of the atropine and source of the atropine. Now, what is the mechanism of action? How it works in case of organophosphorus poisoning? If the patient came to you in emergency and said that he or she has ingested accidentally or knowingly the organophosphorus containing compounds such as insecticide, pesticides. So, how will you treat, or how will atropine work on his body if you give the atropine? So, what is the mechanism of action? If you talk about the mechanism of action of atropine, so normally what happened? There is an enzyme in our body, that is acetylcholine, right? Acetylcholine, and this acetylcholine is binding to the muscarinic receptors, which are from M1 to M5. Means muscarinic receptors are M1, M2, M3, M4, M5. So this acetylcholine is going to bind to these receptors and causing muscular contraction. But in case of organophosphorus poisoning, means if a person has ingested the organophosphorus containing compound, there is already muscle contraction in those patients. Means there is severe muscle contraction in those patients. That's why they have also diarrhea. Means GI motility is too high. There is lot of spasmodic movement in the GI tract. But what will happen? What will atropine do? It will prevent the binding of acetylcholine. It will prevent the binding of acetylcholine to these receptors and thus prevent muscle contraction. So this is a simple mechanism of action of atropine, how it will work. Now, if we talk about the patient which came to the emergency, what are the signs and symptoms the patient will tell? So the signs and symptoms are basically, patient will say, patient will say, or present with signs and symptoms. What are signs and symptoms? Very first sign and symptom is the patient is having bronchoconstriction. Means patient having bronchospasm because of excessive muscular contraction. So we have to give atropine so that bronchodilation will achieve, right? In case of bronchoconstriction, the patient will feel dyspneic, means there is difficulty in breathing. So we have to give atropine to the patient so that bronchodilation is achieved and the patient respiration become normal. The second thing is patient having very high heart rate. Very high heart rate means the patient is tachycardic. There is tachycardia. in patient. So when we will give atropine, it will causes bradycardia or decrease the heart rate. After giving the atropine, it will decrease the heart rate of the patient and patient become normalized. Then third thing is the patient having pinpoint pupil, or you can say the patient having meiosis, because pinpoint pupil or contraction of the pupil is known as meiosis. So in organophosphorus poisoning, the patient having pinpoint pupil, and when we give, as soon as we give atropine to the patient, the pupil become dilated, or you can say mydriasis of the pupil will happen. Mydriasis of pupil, right? After giving the atropine, or you can say cycloplegia. So these are the signs and symptoms. What are other signs and symptoms? If you talk about the GI tract, then in GI tract, the motility of the GI tract will increase in case of organophosphorus poisoning. In case of organophosphorus poisoning, the motility of the GI tract, means the GI tract muscles of the GI tract motility will increase. GI motility increase. That's why patient will present with diarrhea. Diarrhea. GI motility increase. But when, as soon as we give atropine, the GI motility become decrease. The GI motility will decrease, and the GI tract will become normal, and the patient which is presenting with diarrhea having normal stools, right? So these are the signs and symptoms with which patient with organophosphorus poisoning will come. And if we give the atropine to the patient, then patient become normalized. Now what are the brand names with which atropine came in market or available in market? Atropa, then atropine sulfate injection. So that's all for this video. If you like our video, then please subscribe our channel and share this video to the friends. Thank you.